Hi everyone, it's Teresa from Slow Paths Wellness, and today I wanted to give you just a really quick talk about my practice and the kind of people that find my practice really useful. At my heart, I am a do-it-yourselfer. I listen to podcasts, I read books. Before I took any classes in Chinese medicine or functional medicine or really any other topic for that matter, or herbs or anything like that, I had done a lot of my own reading and my own studying and had started kind of playing with the stuff before I kind of went and got a professional opinion. Now, it was very important for me to have that professional opinion. There are a lot of gaps in what I learned just trying to teach myself, but at the heart of it, I like to learn things my way on my schedule and then to just kind of fill in gaps as I go. That tends to be the kind of people who come to see me. So while some people who have an acupuncture practice, the people coming in basically come in, get their treatment, take their herbs, go their way, come back however many times they're supposed to come back, and don't really ask a lot of questions. In fact, I've heard fellow practitioners saying that they don't really talk a lot about the principles of Chinese medicine with people because the people that they treat find it boring or unnecessary or too complicated. That's never been my experience, and I think that's because the kind of people that I get along really well with and that get along really well with me and see really good results for me are the people who are very curious. They like to know what's going on. Why is this working or why isn't this working? What are things I can do myself to make my life better, make my health better, make myself feel better and enjoy my life more? So when you come to Slow Paths Wellness, I call it Slow Paths Wellness because I believe wellness is a journey and it very rarely is something you can rush. You can make a lot of changes and sometimes you can make their changes very, very quickly. But oftentimes, even though you may see immediate improvement, you don't see the full depth of the improvement for weeks, months, in my case, sometimes even years. And so I like to have people who are coming in who are interested in learning how to align themselves as much as possible with the principles of health, and then are willing to continue to do that, sometimes with stopping in occasionally to get some information, or sometimes to keep coming very regularly if they have something that needs that time or if they want to have that extra input constantly where they can ask questions and kind of get feedback, but that they're very interested, as interested in what they do outside of my clinic and outside of their appointments as they are in what happens here within the clinic. So if you find yourself sometimes being getting some flack from your doctor or your other healthcare practitioners because you're always asking questions or you always do your own research and you want to find out everything you can about your condition or how to help yourself or why certain systems in the body do the things they do or why you get unwell, then I think you would really enjoy coming to my clinic, coming and us talking and setting up a partnership because I'm not here to fix people and I'm not here to just kind of be a technician and just do my little thing and send people away. I'm here to really have a relationship with the people who come into my practice to share the things that I know, to learn the things that patients know, because as I believe it was Michael J. Fox said, there's a famous kind of comeback where healthcare practitioners say, don't confuse your 15-minute Google search with my 6, 15, 10, however many years the healthcare practitioner spent on their degree, on my degree in healthcare. Well, Michael J. Fox had a similar idea. Don't confuse your 4 hours of lectures on my disease with my multiple years of living with it. So I believe that the patients are, in the end, the actual experts on their illness. And what I have to offer is help with kind of the outside of that. So you know in your body what's going on. If you have allergies, you know that they're worse with certain pollens. Are they worse when you're tired? Are they worse when you first wake up or before you eat or whatever it is that's specific for you? I know in Chinese medicine and functional medicine that allergies are caused by a combination of lifestyle factors like stress, exposure to allergens, the way that the foods you eat affects your immune system, things like whether you have enough rest, whether you feel comfortable, because when you don't feel safe, whether that's literal life and death safety or whether that's safety as far as feeling confident when you're around other people or just feeling at peace with yourself, then your immune system is more likely to find things to fight because it feels unsafe. And when the two of us come together, we can put that information together. We can put together the I feel better after I've eaten something with the here are some things you can eat that make your immune system more likely to respond to allergens appropriately. And we can put together a treatment plan that matches your needs with your schedule and your preferences. So for some people, especially when they first start coming for treatment, it's a really great idea to come in many times, once, maybe even twice a week, to give your immune system, your nervous system, a chance to kind of get into the gear of acupuncture, to have feedback so that if you're trying something like an elimination diet or trying to give up gluten or dairy or something like that, we can talk about different ways of substituting foods, or just encouragement to notice how it's helping you or whether it's helping you or not, and tweak things on the way. And then as you start developing, as you start kind of getting the benefits of the changes you're making of the acupuncture, then you get to kind of go off on your own a little bit and try out doing things without the constant reinforcement of the acupuncture and the coming to visit, if that's what you want. If it's not, then it is fantastic for me. I love seeing patients. I love being able to talk to patients. I love being able to help tweak things so that they're working as best they can. And we can also, as you get further along in treatment, we can add more of a coaching aspect to things. Because a lot of times, if you've been sick for a very long time, it's really, really, really hard to just kind of ease into trusting your body and trusting yourself and trusting that if you're putting the right inputs in, that better inputs come out. And that's part of my job too. I'm not just someone who sticks little tiny needles in people. I'm not just someone who writes little herb formulas for you to take based on years of experience in clinical medicine. I'm someone that I believe part of my job is to help you and your nervous system and your immune system and your endocrine system and all the different parts of your body to kind of make peace. So if you have an autoimmune disease, part of my job is to help your nervous system feel less stressed, teach you ways that you can help your nervous system feel less threatened, because the less threatened it feels, the less likely it is to have an improper immune response. Now, that's not, for most people, the only thing you need to do. You have to deal with gut health, you have to deal with any infections that may be underlying, you have to deal with making sure you're getting enough rest and have enough support from the community. There's lots of other things. But if you're in a constant state of stress and a constant state of feeling attacked, then your immune system is not going to function properly. Even if it does from one day to the next, in the long term, there's going to be problems. There just will be, because that's how nervous systems and immune systems work. So, if you are interested in joining a practitioner, forming a partnership, and the goal is to help you, your nervous system, and the different systems in your body work well together, then give me a call or send me an email, shoot me a text, because I think we could have a lot of fun working together. So have a lovely, lovely day, and if I can be of any service, please contact me. Thank you very much.